So good afternoon and welcome to bill hearings for the House Health and Government Operations Committee. I'm Chairman Jocelyn Peña-Melnick, and to my left is my wonderful Vice Chair, Ariana Kelly. Thank you for being with us today. This is our first session back in person since 2020, so I ask for your patience if we encounter any technical or streaming issues because it's new. Our staff is doing an amazing job, so be patient with them. Please set your electronic devices to vibrate and don't hold conversations in the committee room while testimony is happening. We're going to hear from the bill sponsor and the bill sponsors panel. The bill sponsor testimony is not limited, but we know you cannot take 10 minutes, so please be kind and reasonable. While all witnesses will have 2 minutes to provide testimony. A timer is displayed, as you see right there. It says blue sky timer. So please pay attention to that, and a sound will be played once that your time has expired. Please adhere to our usual committee rules of one question and one answer from the panel, not one question and one answer from each witness. Please keep your question brief. Members of the public will be able to view the live stream of this hearing on the Maryland General Assembly website and YouTube. Let's begin today with Delegate Collison and House Bill 279. The sponsor panel includes Andrew York, Vinnie DeMarco, who are testifying in person. We will then hear from Jim Goodman, who is testifying virtually. So we're going to do the in-person first, then go to the virtual testimony. Good afternoon, Delegate Collison. Will you be so kind and start your testimony on House Bill 279, Prescription Drug Affordability Board upper payment limits?
Thank you very much, Madam Chair, Madam Vice Chair, members of the HGO Committee. Thank you for the opportunity to present HB 279. It's been 3 years since I've sat in this seat, so it almost feels like a new experience, and the perspective is very different from here. You've heard about the Prescription Drug Affordability Board in the briefing today, and you've heard that it was the result of a bill that was our chair's bill back in 2019, and the reason we passed the bill in 2019 was to shine a light on the black box that I call prescription drug pricing, the pricing chain. And as my subcommittee will attest to you, it is incredibly complex with very limited public information, and it's hard to tell it. You know that some people say follow the money. You cannot follow the money in this chain. So the board was established to try to figure that out, to decide, to see what all the different components of the chain were doing, what their role was, and how the exchange and the work that they were doing affected the prices of prescription drugs. So the goal is to ultimately decrease the price of prescription drugs, but also that would simultaneously decrease premiums. Because you'll recall from our Insurance 101, prescription drugs went from 17% of our premium dollar about 10 years ago, and now they're over 33% of our premium dollar in just a decade or less. The bill was not easy to pass. There was lots of discussion, lots of working together to try to come up with something that we could all agree to. But I think it's important to note that the bill passed the House, this is in 2019, 96 to 37, and it passed the Senate 38 to 8. That's a lot of support for this bill. Now, it was established in 2019. And then all sorts of barriers were thrown up for it to begin its work. There wasn't, they took 2019 to develop a funding mechanism, but as you heard, that funding mechanism was vetoed. And we had to wait a year before we could bring it back and override the veto to get the funding for the bill to do its work. So passed in 2019, couldn't get started until 2021. Then there was an issue around setting up the stakeholder committee. The stakeholder committee was, there had to be a number of appointments to the stakeholder committee. The Speaker, the Senate President, and the Governor were responsible for making those appointments. The Speaker and the Senate President made their appointments. We waited until August of 2022 for the Governor's appointments. The board could not fully engage in its work until the stakeholder committee was set up. That was determined in statute. So it has gotten off to a late start, but I think what you heard from Andy is it's already done a tremendous amount of work. We've used the information from the board to pass several policies in the last year or so, and that are currently in place helping people, one of them being the insulin cap that Madam Chair mentioned before. When we passed the bill in 2019, we were very ambitious. And I think the good delegate asked, how soon could we see an upper payment limit? And Mr. York said, tomorrow, if everything fell into place. And that's how we felt in 2019. So we built into the bill that, by 2022, by December of 2022, we ought to know how this is going to work. And we ought to have things in place. Well, I just told you why that's not possible. But unfortunately, because of the time frame between the session in 2022 and now, there was no opportunity to renew the board. And so it literally, the work that it could do on upper payment limits literally sunsetted on December 31st. In order to reinstate it, you have the bill before you, and that's 279. And that's why it's an emergency bill, because this bill can go into effect as soon as the governor signs it, and the board can maintain its focus on the work it is supposed to be doing and will ultimately benefit us all. Now, some of the original questions that arose when we had the initial discussions back in 2019 are sort of being muttered about. If you want to talk to me about, upper payment limits and how we can do this legally, et cetera, I'm happy to have that conversation with you. It was a 2-hour conversation on the floor in 2019. I'll probably show you the video. But we believed at that time, and I think there's nothing to prove differently, that this was an important way for us to control to begin to control drug costs to us in the state. You'll see a letter in your packet from the Department of Health, and they have some concerns, or they express some concerns around the relationship between our upper payment limits and then the federal upper limits, and how these might conflict or negatively interact. I can guarantee you that with the members of the board and Mr. York as the executive, there is no circumstance under which this board would compromise any federal funding that is the result of the work at the federal upper limits. And Mr. York will explain that a little bit more. They also raised the concern that, there may be shortages, or PBMs might have less ability to negotiate if we have upper payment limits. And again, my response to that is Maryland is a huge pharmaceutical market. There is no way a manufacturer, I do not believe that there is any way a manufacturer will pull out of Maryland because of upper payment limits. They will try to work around them for sure, but I am confident that that's not going to happen. And we're going to have more discussions about them when the process and the recommendations come back from the board. So I think that we can adequately address the department's concerns, and I would ask your consideration for a favorable report to reinstate the board and let it move forward. And with that, Madam Chair, I'll turn it over to my panel, and we'll go with Mr. York.
And thank you for your work, Delegate. Again, good afternoon.
Good afternoon. Madam Chair, Madam Vice Chair, and members of the committee, I'm going to channel the infinite wisdom of our board chair and previous legislator, Van Mitchell, and I will simply say that we strongly support this legislation, and we're excited that it would allow us to continue to do our work to make prescription drugs more affordable for Marylanders. And you also heard me speak for about half an hour. So, but I can also just address the issue that came up from the letter from the Department of Health. And again, I would just echo what Delegate Collison had mentioned, in that I think that is actually just a definitional issue. I think they're talking about a term of art in Medicaid called the federal upper limit, and it just so happens that our legislation has a term that sounds like that, which is upper payment limit, which is a novel concept that we're defining through our work. And as I'd mentioned, when we work with Medicaid, we would work very carefully to kind of work within their existing frameworks. I think it brings up a good issue that we do need to be very conscientious of federal regulations and policies and make sure that we are not triggering anything or violating any programs that we need to be aware of. But I would just say that I don't see the issue that the department flagged as being an issue. We do look forward to continuing to work with them and coordinate with them moving forward.
Thank you. Mr. DeMarco.
Yes. Thank you, Madam Chair, Madam Vice Chair, members of the committee. I can't be any more grateful than I am.
Tell us who you are.
Oh, sorry. Vinnie DeMarco, President of the Maryland Healthcare for All Coalition. Apologize. Madam Chair, Madam Vice Chair, members of the committee, this committee is the place where it happened. The historic 2019 Prescription Drug Affordability Board law. And thank you so much. House Bill 768, Madam Chair, was really a path breaker. 7 or 8 other states have followed our lead, and Senator Van Hollen has put a national bill very similar. I think it had an impact on the Inflation Reduction Act. And we are thrilled how Chairman Mitchell, Andy York, and the board and the Stakeholder Council are implementing this law. We thank Senator Delegate Collison for her incredible work in defending the bill on the floor in 2019 and in this legislation today, which will keep the board going. We strongly support this. We need the board going. We believe they will make high-cost drugs more affordable for state and local governments this year, and we hope to come back to you next year for legislation to expand that authority to all Marylanders. And I want to echo what both Delegate Collison and Delegate Lewis mentioned about the veto of the funding bill by former Governor Hogan. That has caused a problem in causing the board to have to borrow money from the Maryland Healthcare Commission, which is now paying back with its assessment. So we are separately asking your budget committees to award them $100 million this year to help pay that loan back. We want the board to have the full authority it needs, which 279 gives it, and the money it needs, which we are separately asking for, so they could do the job and lead the nation in making high-cost drugs more affordable for everyone. Thank you very much.
And just for clarification, this question is for Delegate Collison. The bill we have in front of us only deals with the sunset, correct? There's nothing else about the funding. There's no policy decision, just a sunset so that the board can continue to do its work.
That's exactly right, Madam Chair. There are no changes in the charges to the board from the original bill. This is simply just reinstating, and through the sunset, the board's work on upper payment limits.
Thank you. Are there any questions for the delegate and her panel regarding this bill? Seeing none, thank you so much for your testimony and for your work. We next have a virtual testimony from Mr. James Goodman, and we'll wait a second or two so the staff can allow him in. But actually, what is your last name? Yes, you're coming, but not now. All right, thank you. And for those of you that are waiting, we have to follow for OIS the way the witness is signed. So we're going to do the virtual one, and I asked already, can change it, and I was told no, so we're gonna follow the list, so just be patient with us, okay? Just pretend that they're here. All right, thank you. And for those of you that are waiting, we have to follow for OIS, the way the witness is signed. So we're going to do the virtual one, and I asked already, can I change it? And I was told no, so we're gonna follow the list. So just be patient with us, okay? Just pretend that they're here. Okay, thank you. And for those of you that are waiting, we have to follow for OIS. Happen, mute yourself, okay? So we're going to. Mr. James Goodman?
Yes,
Change it, and I was told no, so we're gonna follow the list, so just be patient with us, okay? Just pretend that. Is this coming from him? Yes, I think he has. This is coming from you. You must have the computer on. Will you be so kind and turn that off and give us your testimony? It's okay, take your time. I know it happens. Not a problem. You can get started. I do not hear it anymore.
you're ready for me, Madam
Yes,
Chair?
we are. We're ready.
I'm sorry.
It's
Good
okay.
afternoon, Chair Pena-Melnick and members of the HGO. I'm Jim Goodman, and thank you for letting me testify virtually. It helps me with a family health situation. I'm a member of the Executive Council and lead healthcare advocacy volunteer for AARP Maryland. I'm also a member of the Stakeholder Council representing the public for the PDAB. And for the past 7 open enrollment seasons, I've been a volunteer Medicare prescription drug plan counselor for SHIP in Maryland. Before I retired for 25 years, I edited and published subscription newsletters about U.S. healthcare, especially prescription drugs. I'm here representing AARP and its 866,000 members in support of HB 279, and we thank Delegate Collison for introducing it. As you've heard from Andy York's outstanding 101 presentation and from the others, the PDAB has done a lot of excellent work already, and he has done it despite having very limited financial resources. It's now preparing to impose the statute-authorized UPLs on prescription drugs that present severe affordability challenges for state and local government entities. But while it will submit those planned regulations to the LPC as required under the law, there is a need to codify the criteria it's going to use to select those RX drugs that will be subject to the UPLs, the entities that would be covered by the UPLs, and how to make changes in the UPLs where needed. This bill will do all of those things, and it will do them in a clear and fair manner. The bill states that the PDAB would need to cover the costs of administering and delivering the drug involved. It also legislation also provides the framework the PDAB will use in deciding and making recommendations to the General Assembly on whether to extend the UPLs to all purchases and payer reimbursements for prescription drugs. The report containing those recommendations would be presented to the legislature and be based on the initial Maryland experiences with the UPLs, including their effect on purchases of and payer reimbursement for prescription drugs in the state. This bill contains significant protections for everybody, not only for Maryland residents, but even for pharmaceutical producers and entities in the prescription drug distribution chain. For instance, the bill states that UPLs would not be applied to prescription drugs that are on FDA's drug shortage list. That's an important protection. The PDAB also would have to monitor the availability of any prescription drug for which it sets a UPL and reconsider that UPL if a shortage develops. Moreover, the bill clarifies the procedures to be used by the LPC, be used if the LPC doesn't approve or fails to act within 45 days of the PDAB's UPL action plan. In that case, the PDAB would submit the plan to both the governor and the attorney general and could not go ahead with UPLs unless it has approvals from either the LPC or from both the governor and attorney general. When it gets such approval, the PDAB also would be able to apply the UPLs to entities that act on behalf of state and local government, including prisons, hospitals, and health clinics at state universities. I'm just wrapping up here.
You have to wrap up.
Saving them lots of money. Given the importance of this bill, please, the AARP requests that your committee give a favorable report to it. Thanks very much.
You're welcome. Are there any questions for this witness? Seeing none, thank you so much for being with us, and I hope your family matter is taken care of, okay?
Thank you, Madam Chair.
My pleasure. We have an in-person testimony, several actually. I'm going to call the favorables together. Elizabeth Claiborne, Bridge Dumay, are you here? And I have Matt Celentano and Paul Schwartz. And good afternoon, and who would like to start?
First, thank you, Madam Chair.
My pleasure.
And thank you to all of the members of the committee. My name is Bridge Dumay. I am the political coordinator with 1199 SEIU, United Healthcare Workers East. We are the largest healthcare workers union in the country with over 10,000 members in Maryland and DC alone. We support HB 279 to require a prescription drug affordability board and urge a favorable report. The high cost of healthcare and prescription drugs fuels an unjust cycle of poverty and illness that punishes patients for getting sick. Too often, patients delay seeking healthcare or don't take their medications as prescribed because they can't risk medical debt. A healthcare worker shared with me that she's diabetic and her insurance does not cover the medication she needs. She couldn't afford to pay out of pocket and went without her medication for over 4 months. Untreated, her health deteriorated and cost her even more money in the long run. It's unconscionable that there are some healthcare workers who care for our loved ones but can't afford to care for themselves. There's an extreme short staffing crisis across the healthcare industry, and Maryland has the longest hospital wait times in the entire country. To alleviate these crises, we need a sustainable patient-to-worker ratio. Of course, the best way to reduce the burden on overworked healthcare workers is to raise their wages, and to ensure that patients don't end up in a short-staffed hospital or long-term care facility simply because they could not afford to take their medications. Establishing a prescription drug affordability board with the power to cap prescription drug costs will help healthcare workers ensure their patients can afford their treatments and will save patient lives. We urge the committee to vote yes. Thank you.
Thank you for your testimony. Who's next?
This one doesn't work.
It goes on by
there it
itself,
goes.
so you don't have to touch it. Thank
Okay.
you.
Madam Chair, members of the committee, my name is Paul Schwartz, representing the National Active and Retired Federal Employees Association. What I want to point out is that research and development costs of drugs are applied only to domestic sales, not to foreign sales. And the reason for that is that countries like Mexico, Canada, Great Britain, they have price controls in place, which apparently the United States does not. And so that creates the higher prices, or at least contributes to the higher prices. Back in the year 2000, there was a federal bill. It's called the Medicine, Equity, and Drug Safety Act of 2000, introduced by Senator Jeffords, that tried to address this issue by allowing reimportation of the very same drugs. And that, of course, failed and never passed out of Congress. The Inflation Reduction Act that was passed recently, they tried to address this issue about the research and development costs, and I spoke to Senator Cardin on it, and it didn't make it onto that bill, but he did indicate that pricing is a key issue that needs to be addressed. This bill, HB 279, addresses both issues by giving authority to the Prescription Drug Affordability Board to address research, to consider research and development costs, but also to make sure that the profit limitations are in place. It's not just a question of rising prices, it's a question of profits that are unwieldy. And so having this bill and this board in place to have this authority, what failed at the federal level can actually be accomplished at the state level. So we strongly support HB 279.
Thank you for your testimony today. Next.
Madam Chair, members of the Health and Government Operations Committee, my name is Matt Celentano, here today in support of House Bill 279. Due to a variety of factors, Maryland has yet to be able to sort of bear the fruits of the PDAB. We haven't been able to realize the potential of the savings to skyrocketing drug prices. We heard about that from the other speakers earlier and in the briefing about why this was delayed. So we need to continue the PDAB to figure out how we can do and what we can do to give every Marylander the ability to afford their prescription drugs. As you've heard time and time again, life-saving drugs just don't work if Marylanders can't afford them, and we need to figure out a way forward. Just as a reminder, and I think Delegate Collison said in her opening remarks, but almost like a decade ago, the percentage of your premium, your health insurance premium, was about 10% was to prescription drugs. It is now over a third. That is a dramatic increase in your premium. And if we're going to continue to talk about the affordability of prescription drugs, we need to do something about it, and the PDAB is a great step. Part of the reason that we keep coming back and talking about drugs is because we have to do something. There is no control on what the manufacturers can do, and until we have a discussion with them about what is a reasonable list price, we're not going to be able to go forward. And as you're going to hear from me over and over this session and beyond, is that health insurance is really expensive because healthcare costs are really expensive. And the number one healthcare cost that keeps going through the roof is prescription drug costs, because the manufacturers decide to do whatever they want. And it's time for us to take a step forward. Thank you very much, and I urge a favorable report.
Is there a Miss Bridget Dumay?
That's me.
Oh, I'm sorry.
That's okay.
Elizabeth Claiborne. Okay, wonderful. So we have, now we're going to open it up for questions from the committee. Are there any questions for this panel? Seeing none, thank you very much for being with us today. I hope you have a blessed day. We do have a virtual witness, and that is Mr. Kenneth Phelps. And we'll give it a minute for him to come on. Good afternoon, Mr. Phelps. Will you be so kind and unmute yourself, and you can address the committee? Start by telling us who you are.
Thank you very much, Madam Chair and
Our
members.
pleasure.
I am Ken Phelps. I'm the co-director of the Maryland Episcopal Public Policy Network. And I want to start today by applauding the work of the Assembly, as over the past years it has steadily increased affordable access and access to adequate and affordable health care for our citizens. The Episcopal Church, not just the Diocese of Maryland, supports comprehensive health care, recognizes the need for universal and equitable access for everyone. Along with nutrition and housing, we view it as a human right that should be provided to those residing in our nation, and we mean everyone. We support this bill because it's one more step in what we hope are many more, moving us toward the goal of universal coverage. We do need to be more ambitious. Concerning this bill, I'm going to leave arguments about pricing and specific merits to others. We know the excesses of the pharmaceutical industry. We know how exorbitant pricings of medications have historically held individuals and family budgets hostage. I've come today to preach briefly. One of the best kept secrets in the church is the meaning of the word salvation. It's been muddied by tradition and Western individualism, and it has nothing to do with the afterlife. The word from the Greek simply means healing, which simply means that Jesus, our movement's founder's primary mission, was to bring healing to the world, to model what it meant to be dedicated to the spiritual, emotional, mental, and physical health of everyone, to be dedicated to wholeness and to provide and promote it as gift. I mentioned human rights. Among the sins of our nation is that we have commodified so many of life's necessities: education, health, including prescription drugs, housing, necessities that other nations provide for their citizens. I like to remind us from time to time that when our founder did come to his capital, Jerusalem, the first thing he did was to go to the center of government, religion, and commerce and throw out all the capitalists. I'm just saying. So please think of this bill not only as one more step toward affordable care for all, but also one small step toward redeeming our culture. The diocese calls upon you to continue the progress we've made, and we request a favorable report. Thank you. God bless.
Thank you. Are there any questions for this witness? Seeing none, thank you so much, sir, and God bless
Thank
you
you,
as
Madam.
well, and thank you for being with us. For the committee, this is our last witness, and this will conclude the bail hearing. Just for your planning purposes, next week you can expect to be busier, and we will have many bail hearings as the weeks come. And in addition to that, next week you can expect to vote on a couple of bills as well. So if there are any questions that you have, remember, we do use the subcommittee system, so make sure you talk to your chairmans. And there will be maybe 1 or 2 instances where a bill will not go to the subcommittee, but that's because we feel that we can work it out as a body much easier, and it's not, it will make the process more, just to flow a lot better, okay? So thank you so much for your time. Thank you for being on time and really for caring about the committee. You have a blessed evening. Take good care. Bye-bye.